Well, Laura, thank you for coming into our studios today. We're happy to welcome Laura Jamison from Jamison Consulting, who happens to be in our backyard right here in Tampa, and has been serving the dental community and dentists for over 25 years. I think she's completing her 25 years this year. And she's a phenomenal consultant. I've known her for a few years, and we're truly excited because uh, I want to talk to you about what makes you passionate about dentistry and um, why um, have you stayed passionate for 25 years, and how much joy does it really give you when you can go into an office and truly solve problems? I think in all of consulting, I think all of us who like to help, who are in this space, love to solve problems. We love to look at a problem and just go and fix it, and have a systematic approach to it. So, what is it that, I know you got in dentistry, you've been doing this, but what keeps you going, and what keeps you passionate about kind of helping this industry kind of move forward? And so that's my first thought of what, because I'm always interested in what keeps people going to perform at their best.
Oh, thank you. And thank you for having me participate in your program. I really have admired from a distance, although not that far a distance,
That's right.
how well Patient Prism has grown and their commitment to making sure that patients perceive dentistry as something they don't have to be afraid of. So I just want you to know.
Thank you.
To kind of give you a heads up on the why, where I come from, I happened to start in a dental practice that provided exceptional dentistry.
Okay.
They were in the best clinical courses. They had a consultant. They, at the time, decided to expand their property and built a beautifully designed, architecturally designed dental practice.
Okay.
And it was created by a company called Pacific Institute at the time. It became Pride Institute.
Okay.
And I was able to take that practice, working in the practice, from generating about $300,000 a year in 3 treatment rooms with 2 dentists and a hygienist,
Wow.
to a 3,000 square foot facility. And by the end of my 5-year tenure there, we were producing and generating over $1 million in volume. And this was in the early 80s.
Wow.
Yeah. So I was very fortunate to take in that standard. That's all I knew. And then be hired by the Pride Institute, which then counseled dentists on how to bring that type of care to the patient and how to put systems in place that would ensure the patient had the very best experience. And from then on, I've just been impassioned by the thought that we are improving the perception of dentistry one patient experience at a time. So I've actually been consulting for 31 years, 25 years in business of my own.
Okay.
As of December this year.
But in terms of what kind of joy does it provide you when you are able to go and change the perception of dentistry? How does it, when you finish an engagement with a dental practice, and they have implemented some of the changes and in your procedures that you have outlined, what does it make? I mean, how does it? What's your most gratifying moment of your engagement? Is it when you see the results? Is it when the team fully commits to what you have outlined? What is that?
Okay, sure. Frankly, the greatest joy often comes when it can come from 3 different levels, perhaps more, but I'm certainly thinking of when a client feels financial freedom, and that because of the things that they have implemented and integrated into the practice, that their team members feel joyful about being at work every day. The patients are happily returning as patients, boasting about the experience they've had with their dentist and telling their friends.
Nice.
So yeah, when the dentist experiences financial freedom as a result of my work with them, that's one thing that brings me joy. The second thing that brings me joy is when I see a team member transform. When I see that, while they sat there like this,
That's right.
the first couple times, we go through a training session, and then by the end of it, they're the ones leading the charge.
Nice.
That brings me joy. And then I always love it when I'm interacting with the patients and asking about their experience. When I hear the patients say, this was the best dental experience I've ever had, I would never go anywhere else. I know that what I've done is help create that experience for them. Those would be the three
and I think
things.
it's the transformational aspect of what you do is I think what keeps you up, keeps you going, because you're going inside a practice and truly transforming it from the ground up, right? You're not going out there just to put band-aids on a particular idea. Let's say they have a scheduling problem. You're not just going there to look at that, because you will observe a practice, as you've told me before. You observe a practice and kind of look at, sometimes it's you only kind of measure what you see, and sometimes everybody gets so busy in a practice, you don't really get to see things that are not as easily visible to the naked eye. And that's what having one of the questions I ask many folks over the course of my interviews with many people is what's the need to have a coach? What is the need to have somebody look over what you're doing? And I think one part of it is somebody else will see things that you don't see, because if you you know if you see something every single day, you stop seeing it because it's become part of your routine. But if a third party comes by, it's just like the height. If my kids' grandparents haven't seen my kids for a long while, and they see them after 6 months, they've grown taller, but I don't see that. They're growing, and I don't see the changes that are happening. But some third person comes into the picture.
Yeah.
They're able to look at that. So what is that importance? Importance of having a coach, whether it's a dental practice or anything else. What is it? What have you felt? Why do dental practices need coaches or consultants? Even though they're seemingly successful, even though they seem to be doing a good job, they have great production, they have happy patients, they have a good list of active patients, they have a good recall system. Everything seems to be going well, but how do you know that you've reached that optimal capacity? So what do you need a coach for? What can be done? What do you say to people who are saying, I think I got it. Everything is perfect.
And they do say that.
Okay.
They do. Jim Pride used to have an acronym, IDJ,
Okay.
AEYTA. I'm doing just about everything you're talking about.
Talking about.
And so, of course, we run into that. And most times it's the team members. It can be the doctor. The doctor's brought me in to fix the team.
Okay.
And that rarely works out. That my consulting relationship is probably going to be short term in that scenario. If the doctor is unwilling to look at themselves introspectively and identify the behaviors that they also need to modify, then I do think that it's not going to work out very well for them from a consulting perspective. So a coach I think primarily brings not only solutions to problems. When you're in the trenches and you're working on something this big and something that's that big, you really do get tunnel vision. And most dentists just want to do dentistry.
Right.
That talk in the background, it's not there, it's in their head. So while they're working on patients, they're just hoping for the best. So an objective party gives them feedback about things that are being heard and seen in the dental office that they themselves don't see. Most dentists will tell me, I rarely hear that conversation over the phone. So that's where your patient prism is going to be extremely helpful to a client. In addition, many times I'm supported most by a spouse in a dental office. That the dentist who has held everything in all day long then comes home and dumps
Right.
on the spouse or the family. And so the spouse, either working in the office or being at home at the end of the day, is getting some feedback that really a coach helps to filter. And knowing that you have a coach to dump on, if you will, tends to help, I think, the mental health of the dentist and the team members. And then I think most importantly, I feel good about the fact that there have been times when I've been able to facilitate a process for the dentist that makes them feel less stress over making a decision. And it can be whether or not to keep an employee, make a purchase of equipment. I think that when they have someone who has numerous experiences and can say what works, what didn't work, that they feel confident that they didn't have to make that decision themselves and second guess themselves.
I can relate to that because I've been a CPA to dentist for over 20 years.
Yeah.
And one of the when I used to meet dentists for the first time, for my first appointment ever, I used to tell them that, don't hire me because I'm going to do some paperwork for you. You're going to provide me some paperwork. I'm going to prepare a tax return for you, and I'm going to give it to you. I really want to help coach you. I want to help you make good financial decisions as you go along, and I want to be that objective sounding board, because sometimes you'll go to a show and you will say, oh my God, that is I need this CBCT. I really need it, or I need to do CREC because I loved the show I went to, and it was all jazzy and it was fantastic. It's going to fix everything, and I'm going to come back, and you need to go and ask someone else, and that's going to be outside of your practice, and say, hey, what do you think? And you need somebody objective to give you an advice that is not biased, so there's no conflict of interest that you have. And it always puzzled a lot of my clients at the time, because they thought I was just going to give them a bunch of financial statements and tax returns, but then they were in for a lot more than they bargained for. Eventually, they did like it, but I think what you say makes sense, because having a coach at any level, I think we've seen the greatest athletes still have coaches.
They do. That's metaphorically
the
a
greatest
great example.
performers, whatever field you may be in, they have coaches. Businessmen have coaches. I think I've heard some of most of Fortune 500 CEOs have personal coaches. So if they need it,
consultants have coaches too.
And consultants have coaches.
We wouldn't be good at what we do if we didn't have someone to bounce ideas off of as well.
Absolutely, and tell us what we don't know. And I think that's always the purpose in life, I guess, is tell me what I don't know, because I know what I know, but I don't know what I don't know. So if somebody can tell me what I don't know, then I think I can have better decision making than pure gut-based decision making that most people engage in. My gut tells me this is the right decision, but sometimes your gut is wrong, because it's all based on emotion.
Yeah.
And I think the coach takes that emotion out of it and kind of objectively lays out the pros and cons of making a decision. Because at the end of the day, whether you're a dental practice or any other business, the decisions that you make, and sometimes the small ones, can have a major, long-lasting impact on your practice. You whether it's buying an equipment or buying building, whatever that might be.
Okay.
So that's that. So let's switch gears a little bit to. I talk to hundreds of dental practices now across the country, from small to large, and one of the key pain points that I hear, besides the pain point that I solve, which is front office conversions, is everybody pretty much says that Amol, the primary reason that I cannot grow my practice, or I cannot operate at optimal efficiency or optimal effectiveness, is my team members are not the best, or I can't hire good staff. It's hard to find, or they're hard to retain because there's a lot of turnover. So it's the team seems to be the Achilles heel of a practice, and I've said this to many dental practices over the years, is that if you don't have a good team, no matter how great of a clinician you are, how great a marketing system you have, you are not going to succeed. And if you succeed, you're not going to reach your full potential, because the team is what carries you to the finish line. And you may think you've reached the finish line because you don't know where it is. And so what are the optimal ways? How do you create, first of all, an atmosphere that inspires and motivates current staff to be happy with what they're doing and perform at their peak? And then what do you do to recruit? What kind of steps? And I know you do some of part of it in your consulting.
Yes.
Is how do you recruit the right people, and then how do you retain them and motivate them and inspire them to perform at their peak?
Okay. Well, I'm glad you asked. I just even had the recent experience of a client who'd had to let go of his office manager after 30 years.
Wow.
25 years too late. And he was panicked. I mean, he was sincerely panicked. And I offered, because I had my calendar clear for that last week in August, that I'd just come down to Palm Beach Gardens and help him. And
Okay.
so I just jumped in, We preserved the relationship of the newly hired business assistant who had threatened to leave
Okay.
because she couldn't work with the former office manager. And together, she and I were able to greet patients and introduce her. But more importantly, I actually took the hiring practices that I teach my clients and I actually implemented those steps on my own that week. I was there
Okay.
from Monday through Thursday.
Okay.
So the very first thing, as you said many times, you put patients, put people before profit. So a good team is going to be essentially motivated by that message. That has to come from the leader. And again, if a leader is financially disempowered, bad choices or slow production or slow to start out of the gates, they're going to probably put a lot more focus on making sure their day is generating some profit. It evolves, they can evolve, but they have to believe that patients are most important and that profits will follow.
Right.
That's going to attract the best quality individuals. And then in going through the process of hiring, there are a couple of things. One, you want to make sure you start by networking. I've seen things like the website always saying, we are always looking for the best people. If you're interested in working in our office, please submit your resume to.
Right.
We certainly let patients know we're looking for the best person. But then you can also use things like dentalpost.net or Indeed, and those are at least resources for submitting an ad, which is tons better than it was 25 years ago when we'd have to take out a newspaper ad and it was $700 for 200 words, and it's just become less expensive to put that out there nowadays. So I actually take my clients through a 3-step process. One, that they of course put the word out there, and in response we ensure that there's someone who will take the telephone screening, the call. Whether it's calling someone after receiving the resume, they're going to do the telephone screening then, or if someone calls in, we'll do the telephone screening that way as well.
Okay.
So there are a couple things that you learn. I mean, you get the quality of their voice over the phone, what type of grammar they use, how professional and or focused they are on finding the right position versus how much do you pay.
Sure.
So the telephone screening is essential for me to then determine if I want to have them come in.
Okay.
Now, this is a little old school. Clients still wonder about this, but I do have a package with this training material. It's a 50-minute training CD, but forms that go with.
Okay.
And an application form is included in that. So
Oh,
I still
wow.
have clients ask me, really? Because they've submitted their resume. But that's just the thing.
Okay.
So we ask them to come in to fill out an application. Doesn't mean we're going to introduce them to the doctor. Because if they show up in flip-flops or in low-bearing top or
Right.
really, really short skirt or something very inappropriate, thank you for the application. We're collecting them and we'll get back with you.
Perfect.
In addition, the application gives you a sense of what they create versus having it proofread. Or any resume can be proofread.
Correct.
So we get a lot of input on how they structure their sentences by writing their things down. The quality of their handwriting sometimes is important.
Very nice.
So that's all part of the process. That's step 2. And so step 3 is then to interview with the doctor, and then a proficiency interview following that if the doctor believes that this could be a good fit. And we want to make sure the proficiency interview is scheduled for the purposes of that person coming in working side by side. If it's an assistant, we get to see how they work with the doctor. If it's a hygienist, the hygienist gets to see the quality of their skills. If it's someone working at the front desk, then we get to put them on the phone. How do they interact with patients? So that would be like the third and final step. We would then determine from our pool of prospects who's going to be the best fit. Lastly, when the leader puts people before profit, they can expect a lot. Pay them well, give them incentives, but for the people who, the point I want to make is to whom much is given, much is expected.
Right.
And if you have a culture where that's the understanding, then I believe that any dentist can accomplish a long-term relationship with their team members.
A lot of people, I think you make great points because you really have to hire right.
Yeah.
Jim Collins in his wonderfully written book, Good to Great, says,
Love it.
you have to have the right people on your bus. And if they're not the right people, they have to get off the bus.
Mhm.
And so it's very important. The hiring process is crucial.
Yes.
And it can't be just compensation driven, and that cannot be just whether you just like them, their personality. I think having them go through this exercise at the office, I think, should definitely shed some more light. Are there psychological profiling questions within that
Mm-hmm.
you'll use?
Yeah, if you think about it, the telephone screening is to assess certain skills. The appearance for the application is to assess certain things that you don't get over the phone.
Right.
The interaction with the doctor is, really going to emotionally, for the most part, dentists will make an emotional
Right.
decision to bring someone in for their proficiency interview. And then finally, having the whole team be able to interact with the individual or prospective hire.
Right.
It's all somewhat taking into consideration. And one of the forms I include in the package, Extraordinary Employees,
Okay.
is essentially a table with 60 different characteristics and traits that we would observe. Did we observe it in the telephone call?
Wow.
Did we observe it in the application interview? Did we observe it while the doctor interviewed? And was it observed in the proficiency interview?
So this is so you spend a lot of time beforehand, before we're making the hiring decision. You're going through this 4-step process
Mm-hmm.
to ensure that, the fit's right there.
Yes.
And then, how about communicating expectations of that job? Especially, does that happen at the proficiency interview level, where you're saying, okay, here's how we think you're the right fit, but here's what our vision for the practice is, and here's what you bring to the table that's equally important. And so where is there discussion of expectations on what is it that you're expected to do at here, where it's just more than your job, but it's a career. You're going to come out here, and how do you communicate those expectations?
Oh, I'm so glad you asked, because so many dentists do not do a very effective job of this, Amal.
Oh.
I'm sure you may know this. Certainly anyone who's truly invested in having a human resources company work with them to create their manual would have job descriptions.
Sure.
Many of the doctors that I've worked with have a written philosophy statement. And I introduce the written philosophy statement and the job description, somewhat describe it over the telephone call,
Okay.
and then we have it in writing to present to them in the proficiency interview.
Okay.
So that we're killing 2 birds with 1 stone. I really believe a proficiency interview gives you almost 3 hours, perhaps, up to 3 hours. Doesn't have to be that long.
That's pretty
To
amazing.
do some training. If this is going to be the person you hire, they've spent at least 3 hours seeing how you answer the phone, how you set up a tray of instruments, how you put it through the sterilization system.
I think it's important because, spending that time beforehand, before you hire a person, I think saves a lot of headaches afterwards. Because
Oh, yes.
sometimes, as you've seen, that lady was fired 25 years too late. Sometimes there is that inherent inertia not to fire a person because somehow you feel mixed emotions about, oh, they will change, I don't want to be a bad guy, and that kind of stuff. So it's really important to have a good methodical process in hiring people,
Mhm.
not just put an ad on Craigslist and just interview and then have them start working,
Mhm.
but kind of go through this process so that you have the best chance of having the right team member that fits within the values.
Yes. And I did mention dentalpost.net, and if I may circle back around, you were asking about the psychological profiling.
Yeah.
There is a standard or a part of the subscription to that.
Okay.
It's a monthly that you can cancel at any time. They do have a premier level,
Okay.
which does do the psychological and personality profiling.
Oh, wow.
Yeah.
Okay.
So a dentist can choose if they would like that.
And what is that? What?
Dentalpost.net?
Oh, dentalpost.net.
Mhm.
Perfect. Perfect. Well, that's good. So here's another topic that I feel is a little it's a little sensitive because I think a lot of dentists will go out, and most of them are fact finders. They like to gather a lot of data about a lot of things. They love to improve their own selves by going to courses, and they'll hire consultants. They'll do all sorts of stuff, but sometimes there is no action taken at the end because somehow what they have learned, if it's an easy action, they'll do it all day long. Which means if the solution is to buy a product, they'll buy it. If it's a consulting package, they'll buy it. And that's it, right? Because after that, how do you, as a consultant, let somebody has hired you, and what do you, how do you make sure that you're not recommending to a practice something that is so unrealistic, like a green beans only diet, or something like something that's not sustainable?
Okay.
How do you ensure that uh, your recommendations will fit within the culture of the firm, culture of the practice, and there is buy-in from the team members? Because if there isn't, if they'll listen to you while you're talking to them, they'll nod, they'll say yes, 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 but at the end of the day, if it goes against everything that they're doing, uh, um, or if it makes them change so dramatically, they'll just go back to their old habits. So how do you ensure, what's the process that you use to make sure that the diet that you're prescribing is something that's sustainable for whatever goals they're trying to reach?
I'm so glad you asked. You're asking some great questions.
Perfect.
Um, when you think about why people do things that they do, you always want to start by asking them what prompted them, what motivated you to make this call, what do you want to achieve, what's your end game here? So I ask that question in multiple different ways to get as much as I can.
Okay.
And then you always have to remind them that this is where you're heading. There are going to be bumps in the road. And I actually have, on the back of my agreement with a new client, 7 steps to success, things that can get in the way. That in order for this to be sustainable, these are things you're going to have to know in advance. So I do set that expectation up front, so that when, for example, a team member they had on board for 10 years leaves because there is a consultant,
Sure.
that it's not a good reason to just quit,
Right.
the program. So my experience has been, I can give anybody a straight answer. People don't always want you to tell them what to do. Matter of fact, very rarely do people like you telling them what to do. And so over the course of the years I've consulted, I used to start off with the script. I now take them back to what they want to achieve. And I'll even ask the team members. So as a full analysis of the practice, I'll send a workbook out and ask the team members, what do they think is working well? What would they like to see improved? And then I'll spend quality time with them while in the office. Listen to them. Many times it's the team members that grow trust very quickly in that first day because they felt listened to for the first time. And so then to help the program or the recommendations be implemented, I've learned to say, okay, here's what you want.
Okay.
So you want a bonus. Okay. Doctor is willing to do that as long as the bills are paid. So what do we need to do to get to a productive daily schedule? And then what's the step to get to the productive daily schedule? Well, maybe it's number of new patients or case acceptance improving. All right, so let's take a look at what would need to happen in order for case acceptance to improve. So I take them through a process where I'm facilitating, I'm listening, and then ultimately what I'd recommend for them is something that they come to themselves. So the fact of the matter is, as long as it's their idea,
Right.
they're gonna run with that.
That's absolutely phenomenal, because if you start with what they wanted in the first place and then gave them a roadmap to achieve what they wanted, then they want to stick to that roadmap.
Yeah.
Because it gets them what they wanted, right? It's perfect, because otherwise all you're telling them is, these are the things we need to do: production, number of new patients, but they really don't know how that accomplishes what they want.
Yeah.
In their and having that interview process with the staff members, even I think with the dentist is important, because they want to feel that, okay, I have made these goals myself, and once we make these goals ourselves, we're committed to following through, and all then I have to do is follow the steps that you're outlining, because I know that they're going to get to where I want to be, because I have myself verbalized those goals or written them down at the beginning of the process.
Okay.
I like that.
Yeah.
I like that a lot.
Well, I hope those that are listening to this like that a lot too. That
Yeah.
even from the dentist's perspective, if they want to get more of what they want from their team members, they have to be effective at helping them get what they want. You know, in the end, again, people, you know, whom much is expected,
Much is given, much is
much is
expected.
given expected. Yeah, there, you're right.
Absolutely. And I think we, you know, I think alignment is important. You know, aligning your interests with the team's interest and aligning the patient interest with your interest. When there is a alignment of interests, I think good things happen, right? Because you are in a position where, you know, patients know that you are going to do everything and that's in their best interest, because you've aligned your goals to their goals, and if their goals are to achieve optimal health, then there you are, your communication is aligned with their goals, which is optimal health. One of the things that one of the areas that has been showing a lot of growth in dentistry is the whole oral systemic health connection, and more dentists than more and more dentists that I talk to all across the country are starting to wonder about whether to add that component within their practice. And some are saying that, you know what, I think it's great, we need to adopt it because that's where the future is.
Yeah.
Some are still reticent and they don't want to kind of wait and watch. But what do you think? Where is this oral systemic health uh, uh, process going, and what do you think dentists should do at the minimum today to have some sort of uh, holistic practice where you are, you know, because you're now here, you are living in a world where everybody has access to lots of information and at their fingertips, right? And if you have the luxury of your patient's time,
Yeah.
and it's a
Yeah,
luxury.
that
It's
is a
purely a
luxury.
luxury to have a client, to have
Yeah.
a patient. It's luxury, and they're giving you their time.
Yeah.
Is it imperative for you to do some sort of screening, or you know? So where does a dental practice start today in terms of offering oral systemic health services, adding that as a niche within their practice, and what all can you do?
Well, frankly, there are several components to considering the oral systemic link as a benefit to a dental practice.
Okay.
And I'm going to start with why I created dentistryhasaheart.com, which
Okay.
is a free resource for dental team members to use. In 2008, 2009, when the banks were closing and cash was not readily available, credit was not readily available, one of the very first things to suffer, particularly in a dental office, we saw that hygiene appointments were quick to be canceled. Dental appointments too, but really, I saw hygienists being sent home without pay if they didn't have a full day of patients because
Wow.
the doctor was very, discouraged. I saw hygienists looking for different jobs because they weren't getting enough hours. So that the purpose of creating dentistryhasaheart.com was simply to take note of the fact that in the early part of every year, American Heart Health Month is throughout the month of February. Well, if we started to educate the patient while we have the luxury of this time,
Right.
captive audience, with my hands in the patient's mouth,
Right.
to begin to talk with them about the significant reduction of risk, particularly with heart disease. 30% less likely if you're without any infection in your mouth.
Wow.
So I began to educate hygienists and dental teams about the correlation. You know, that plaque under the gum line is the same plaque that lines the arteries. That infection, chronic infection, causes the liver to generate a reactive protein. And that these are numbers that can be measured by sending a patient to have some blood work taken.
Okay.
And then even after periodontal therapy, that you can send them back for
And
them
see
to
what-
see, the reduction in their high-sensitive C-reactive protein. Diabetes month, I believe, is in May. So again, if we see high A1C numbers in the blood work, to bring to their attention, if they're pre-diabetic, that keeping chronic infection under control is imperative because diabetes is otherwise very difficult to control if you don't. Oral cancer, April being Oral Cancer Awareness Month.
Absolutely.
That oral cancer actually kills, when you start to just say things like this, when you have your hands in the patient's mouth, one person every minute of every week, of every day, of every month, of every year dies of oral cancer because it's not detected until the very late stages. That at the very least it's deforming. And so this is why we use, whether it's the Velscope, the Visalite, the oral cancer screening tools. And frankly, even those patients that we have to encounter that objection, well, how much is it going to cost? It will be the least expensive life-saving procedure you will ever have to invest in. It's $35.
So so you think it's imperative for general dentists or all dentists to start incorporating these things because that's what's best for your patient.
Yeah, it engages the patient long term. They're not just learning about the cosmetic benefits of dentistry. They're learning something about themselves personally. I think anytime you can educate someone that they can come away from their dental appointment saying, one person
Wow, I didn't know that.
every day, of every week, of every month, of every year. So when, for example, they're at lunch with their friends, they're able to say, chronic inflammation creates, difficulty for diabetics. I had to say that to my father-in-law at one point in time. So that's something that people enjoy. They enjoy learning something about themselves. And when they see that we're personalizing our care for them and it's not strictly cosmetic, then we really truly are improving the perception of dentistry, one patient experience at a time.
And it does end up building more trust
Yes.
with the patient because now they feel you're going above and beyond your line of duty to help them achieve better outcomes. And
Yes.
it doesn't have to be where you are. It doesn't have to be a profit center for your practice, but it certainly acts as a vehicle for you to maintain your current patient base because now they feel that they're getting a lot more in value from their experience. They're also going to refer more patients to you because now they say, hey, my dentist did this thing. My dentist did oral saliva testing, and it's amazing. And so that's going to do that. So you definitely think that offering some services in this realm is almost becoming imperative for every dental office.
Well, it's global in nature. I mean, AOSH, the American Association for Oral Systemic Health, does a fantastic job. It's growing phenomenally.
Okay.
In its membership, is doing a great job of really bringing some very hard facts and statistics and research to those members that are involved in it. I will say that it can be as simple, though, as the hygienist taking the time, instead of talking to them about what's going on with her family and where she's going on vacation, well, she's got her hands in the patient's mouth and a captive audience. She can be educating them with some statistics about the effects of inflammation to overall health.
So we need to send hygienists then to AOSH meetings.
Yes.
And understand what's going on because they need, obviously you're absolutely right. The person that has the most amount of conversation time with the patient is the hygienist. And if they're not equipped with all the knowledge and the tools that will enable them to gain the trust of the patient. And you don't just gain trust by telling them, oh, you need a crown and when are you going to get one? You gain trust by giving them information or that is going to help them achieve whatever optimal outcome that is. It doesn't matter whether it's you're talking about whether about a sports game or whether it's about their heart health. Anything that adds to their knowledge base or adds to some value to them, they're going to slowly start developing that trust with you.
Yes.
And it's going to help everything downstream, case acceptance, everything else. So I think I've been a big proponent of developing hygiene as leaders in dental practice. And I had a great conversation yesterday with a phenomenal consultant who talked about the hygienists and the dentists needing to synchronize properly and kind of meet every month and talk about their goals and what's going on with the practice and actually co-lead the practice.
Yeah.
Because that then leads to all sorts of amazing things in terms of building patient trust and case acceptance and all that.
Yes, it does. And too many dentists put a limited expectation on hygienists that they need to produce X per day.
Right.
When frankly, if the hygienist is able to keep the patient returning on a regular basis because of that trust, if they're able to communicate the treatment and reinforce treatment plans that have been delayed or phased and postponed at each visit, I think that brings far greater value.
That's great. So what else is we're going to be at the ADMC next month. Patient Prism is excited to be part of this group. This year it's the 30th anniversary. What's in the store with ADMC this year? What are we celebrating? What are you guys celebrating? Because it's an incredible organization with people who truly care about dentistry, people who truly care about improving dentistry. What is it?
Yes, we
what's
are.
so what's how are the celebrations coming along, and how it's coming up in a couple of weeks?
Yes.
What is there anything special going on for the 30th anniversary?
There are.
There's some. Are they secret?
It's a party.
It's a party. Okay. Well, good.
30 years is a big deal, and we are going to honor the founder, Charles Kidd, who, as president of Trojan Information Services, had a vision for encouraging dental management consultants. At the time, I believe in the beginning, the very first meeting, there were only 6 or 10
Wow.
consultants, of which Deborah Engelhardt Nash, our president, was one of them. So she's the one that's been there the longest in our current membership. But the meeting will honor him. It will honor Deborah. It will honor the membership. We had 34 new members apply and be approved this year, and that's not an easy process to pass that. You have to have been consulting as your primary form of income. You have to have had a letter of recommendation. You have to have been sponsored by a member in good standing. So we're celebrating that. We have you celebrating with your flash booth.
That's
And
right.
that'll be fun to have props that we can then, just take pictures as memories of this 30-year celebration. We have some great speakers. The membership tells us that this is perhaps the one investment that they do make in education for their own business. So we made sure to have some speakers
Very
that
nice.
were very specific to sharing their own experience as a business owner, training techniques. We're going to learn a lot about HIPAA compliance and high-tech compliance.
Very nice.
Because it's a real hot-button issue right now. And certainly we'll have some motivational speakers that are going to give us some fun moments, and we're glad you're going to be part of it this year.
We're excited. I'm excited to be part of ADMC because I feel my vision is very congruent with their vision. Is they want to improve dentistry. They want to do it through better education, and part of the reason why we launched Patient Prism was not because we wanted to create a software company. Was not because we had this idea that, hey, let's create a software solution for the dental industry and then gather a bunch of dentists and then eventually sell it somewhere else. Our goal was to truly solve a problem that afflicts most practices, which is front office conversions.
Yes,
But while I was doing that, while we were developing this incredible solution that accidentally turned out to be the best out there, and we were pleasantly surprised by that. Our goal was not to sell the solution, but then we realized that we have to connect the dots, which means you can't just tell your team members what they're doing wrong, but you also have to motivate and inspire them and educate them constantly.
Yeah.
So we launched ConstantCoach.me, and it's truly a platform that's inspired by the Khan Academy, which, as you know, is the world's largest
I love
free learning management system. And education truly, makes us free. And what we were trying to do is have uh, as much of the membership of the ADMC to kind of participate in this process, which is mostly altruistic, which means that we want to convey um, um, our thoughts and our ideas and make people and make our customers who are dental practices and all the team members buy into of what we're trying to do here. We're trying to educate, we're trying to empower everybody with knowledge and information. And once they have that, as you said earlier in your philosophy of consulting is once the team members from dentists all the way down to whoever front office assistants, once they have understood what they want, then they will take all the steps necessary to get better.
Yes, they will.
Right? And that's the goal at Constant Coach taught me is to be able to educate quickly this new generation of millennials that's entering the workforce. Educate them quickly, make them understand what the problems are, what the solutions are very quickly.
Yes.
And if they do need more help, now that they have uncovered, they have found out what they don't know, they can go to consultants like you or a vast ocean of consultants that are out there. But now that they know what they want, they'll be able to find the right person that can help them get there.
That's a really good. That's a really great. I think jumping off point as well. That there's a consultant for anyone who's looking for help.
Absolutely.
And that I may not be the best consulting fit for a particular practice, but I may know someone who does.
Absolutely.
And ADMC has a theme going through this year and next year, and it's stronger through collaboration.
Absolutely.
So with not only our membership, do we want to share who specializes in what specifically, where are they geographically, but our sponsoring partners, to even just know what our sponsoring partners are able to help in terms of collaboration.
Yeah, and once you collaborate and then once we get the message out to the masses, people will choose. People will know once you have empowered them. Nobody wants to be spoon-fed. Nobody, like you said, nobody wants to be told what to do. You just provide them good education. You provide them the tools that will enable them to come up with the right formula for their practice success. And it might be different for each person, right? This dentist who is in Houston might have a different formula by somebody who's in Hiram, Georgia. There might be different formulas, and there might be different personalities that you get along with. But through ConstantCoach.me, we really want to promote education to the masses of dentists and dental team members.
Yeah.
And through that education, we want to truly build a portal like the Khan Academy that will transform dentistry for the better.
Well, and I have to say, ConstantCoaching.com is very catchy.
That's good. That's good. Mike, our CEO, came up with the name, and it's absolutely, and it came from research of, I think what do people want today is because we are so, in tune, we're so attracted to our phones and to devices, and we constantly are seeking more knowledge, and sometimes we don't need it, but we're seeking it anyway. But having that ability to constantly upgrade your skill sets, and one of the thought processes in psychology has been how do you really truly get better at anything is through deep practice, right? And how do you deep practice is you kind of reduce a complex matter into small chunks. They call it chunking, right? And then you say, that's one of the reasons why we've kept these videos short, because we want everybody to learn in chunks, and so if you're involved for that 3-minute window, and in deep practice, which is that chunk of information, it could be just how to correctly place a caller on hold, and that chunk that you learned in that 3-minute window, it's more effective than going through an entire day of seminar sometimes, because now you're learning. But sometimes when you realize, and you can learn in different areas, sometimes you can take an hour webinar, and that's plenty, because now you can go and assimilate that and apply that. And we're going to try some of these things and see what works the best. And we're going to employ technology to kind of get our message out there. But I really appreciate you coming down to our studios here, and you're welcome anytime because obviously you're nearby. We're looking forward to your webinars and some videos that you're going to come back after the ADMC and do for us. So we're looking forward to that, and then thank you.
It's my pleasure. Thank you, Amal.
Thank you.